Hi, Dr. Z here from Desert Breeze Dentistry. In today's video, we're going to be talking about a case that we worked on the front 6 teeth for this patient. As you can tell in this picture, the patient had old crowns and cavities starting on the lateral incisor and the canine, and they are those teeth here. So after telling the patient our findings, and the patient has been unhappy with the color and the way the teeth look for a very long time, we went through the options of what we could do. So we decided to do 2 veneers on the front teeth and replace the old crowns with newer crowns and newer materials. So in this case, we gave the patient some pills, we put her on gas, so she was very comfortable. The patient doesn't remember at all what happened. So after getting the patient real nice and numb, we do all our work. And this is the first appointment is the appointment that takes the longest, so it takes a few hours to do that. The good news is that the patient didn't remember much of that visit, and it was a very comfortable and pleasant visit. And our goal always here is to make sure you have a nice visit, especially when we work on big cases like that. Sometimes we could do what we call oral conscious sedation, just so you're comfortable and you don't have to be stressed or remember much of what we did that day. So after completion of the first visit, you always leave our office with teeth. So we make temporary crowns or veneers that look very good, not as good as the final ones, but really good and aesthetic to where you can wear them for 2 or 3 weeks until the final crowns come in. The second visit is very straightforward. For this case, we didn't even have to numb the patient. We removed the temporary crowns, and then we cleaned out the teeth, and then we tried the final crowns and the veneers in. And the patient really liked them. We took x-rays of them, and then we were ready to glue them in. And as you could tell here, this is the after picture, so you could see the difference from before and after. I hope that this case was very informative to you, and it gives you hope that if you have any old work or any areas in your mouth that you're not happy about that we could help with, you can always give our office a call and come in for a consultation. And we specialize in cosmetic work like this. If you find this information valuable and you like our videos, please feel free to share it with people you know. You could also follow us on social media at Desert Breeze Dentistry on YouTube, Facebook, and Instagram. We would love if you subscribe to our channel and give us a like.